Now, you went on after you left school to become a critical care nurse, is that right?
Yeah.
Tell me what skills you've been able to bring across from being a critical care nurse with a background in horses, but just thinking about the nursing now. What skills there have you been able to bring across to your current position or, working with horses and people now for the equine wound care? It's more than equine wound care, isn't it?
Absolutely, yeah. I do horse first aid, equine wound care. As I say, I look after horses that are sick or injured. I've done that for the last 13 years. So I've looked after a lot of different types of horse wounds, so post-operative care, very unwell, pedal bone penetration, laminitic horses with complex medical needs, because if it's simple, people will manage at home. But if it's complex, they're struggling to get the care given. And that's where we've got lots of tips and tricks and hacks that we can do. It's one thing for a vet to come and sedate a horse and give treatment. It's another thing to do that day in, day out without the horse getting sick of it and getting pretty fed up and developing a whole range of behaviours and phobias about the treatment. So we've got a range of strategies for that. So I think the transferable skills assessment. So as a critical care nurse, you are always doing assessment, so top to toe. And so those assessment skills are the same when you're looking at your horse. And so what we focus on is assessing that horse, developing treatment or management plans, and then monitoring the horse as well. So knowing recognising when things deviate from normal, you have to have a really good understanding of what normal physiology is, what's going on. All of those physiological and pathophysiological processes are similar. People are mammals and horses are mammals. And so there's some similarities around that. Some of the treatment programs, like giving injections, bandaging, wound care dressings, understanding science and understanding the difference between pseudoscience and science, and being able to critically analyse information that's out there. So, a lot of horse people will say, oh, well, the studies say this, but actually studies in horses deal with small numbers of horses. There's very few studies with over 1,000 horse participants in them. And often they're more subjective and qualitative studies as opposed to blind controlled studies of anything. So what we've got to do is, so the evidence in our horse research is not overly strong. We have to look at the trends of what that information means and then make some kind of adjustment to it. So I think that's transferable.